Some of the most damaging intimacy mistakes after 60 do not feel dangerous when they happen. They feel considerate. They feel private. Sometimes they even feel like love. You ignore discomfort because you do not want to ruin the moment. You hide a change in your body because you do not want your partner to worry. You quietly take a product that promises better performance because asking a doctor feels embarrassing. Or you decide that intimacy is simply supposed to become difficult with age. But intimacy after 60 is not the problem. The real problem is using old expectations in a body that now gives you new signals, then misreading those signals as rejection, failure, or proof that something is permanently broken. Today we are going to uncover 7 common health mistakes older adults make around intimacy. 1 begins with the clock. 1 may start with a new prescription, and 1 can be hiding inside a product labeled natural. Stay with me because the mistake near the end is the one that can turn a private performance concern into a serious medication risk. And the final lesson connects every mistake in this video with 1 simple question that could protect both your health and your relationship. Before we begin, this is general educational information, not a diagnosis or personal medical advice. The examples you will hear are fictional composites designed to show how these situations commonly unfold. New, severe, persistent, or worrying symptoms should be discussed with a qualified healthcare professional. And let us remove the shame immediately. Wanting affection, closeness, or a fulfilling intimate life after 60 is not strange. It does not mean you are pretending to be young. Aging may change comfort, timing, desire, mobility, and physical response, but it does not erase the need to feel connected. In fact, the body may not be saying no. It may simply be asking you to listen differently. The first mistake is trying to use yesterday's pace in today's body. Imagine a couple named Thomas and Helen. They have been married for more than 40 years. They still love each other, but recently their intimate moments have started feeling tense. Thomas thinks Helen is losing interest. Helen thinks something is wrong with her because her body no longer responds as quickly as it once did. Neither says this aloud. Instead, they both try harder to recreate the way intimacy happened decades earlier. The same speed, the same routine, the same unspoken expectation that everything should happen automatically. And every time the moment does not go as planned, the next attempt begins with a little more pressure. This is where many couples get trapped. Physical readiness and emotional desire are not always synchronized. A person may genuinely want closeness while still needing more time to become comfortable or aroused. After menopause, vaginal tissues can become thinner, drier, and more easily irritated, and natural lubrication may take longer. For many men, erections may also take longer to develop, may require more direct stimulation, or may not feel exactly as firm as they once did. An occasional difficulty does not automatically mean there is a medical crisis, but rushing can make ordinary changes feel much worse. When people feel watched, tested, or hurried, the body often becomes tense. Discomfort increases, arousal may fade, an erection may become harder to maintain. Then both people leave the moment with a painful story in their minds. She does not want me. He is no longer attracted to me. I am failing. But sometimes the problem was not attraction. It was the clock. The better approach is to remove the requirement that every intimate moment must follow a fixed sequence or reach a particular finish line. Allow more time for affection, conversation, relaxation, and gradual arousal. Choose a time of day when fatigue, stiffness, or pain is less noticeable. A warm bath, supportive pillows, or a different position may help when arthritis, back pain, or limited mobility is involved. And here is a small change that can transform the emotional atmosphere. Agree in advance that stopping, slowing down, or changing course is not failure. It is communication. That matters because the second mistake begins when someone notices pain but decides to endure it. Margaret had been experiencing dryness and burning for months. At first, the discomfort was mild. She told herself it was simply part of getting older. She did not mention it to her partner because she feared he would hear, "I do not want you," when what she really meant was, "I want this to feel safe again." So she stayed quiet. Over time, her body began anticipating pain before intimacy even started. Her muscles tightened, her anxiety increased. Affection itself began to feel like the beginning of an obligation. A physical problem that may have been manageable was becoming an emotional wall. Persistent pain during intimacy should not be treated as a test of devotion or toughness. Vaginal dryness after menopause is common and can contribute to irritation and painful intercourse. Water-based or silicone-based lubricants may reduce friction during sexual activity. Vaginal moisturizers are different. They are generally used regularly to help manage ongoing dryness, not only at the time of intimacy. Some people may benefit from prescription treatments, including local vaginal therapies, but the right option depends on medical history and should be discussed with a healthcare professional. And products should not be chosen carelessly. Fragrances and irritating ingredients can make sensitivity worse. Some oil-based products can damage latex condoms. If pain continues despite simple comfort measures, it deserves an evaluation rather than endless experimentation. Pain may have causes beyond dryness, including infection, skin conditions, pelvic floor problems, inflammation, injury, or other medical issues. For men, a new painful curve, pain with an erection, sores, discharge, or burning with urination should not be ignored. For women, persistent pelvic pain, unusual discharge, unexplained spotting, or any bleeding after menopause should be evaluated. The sentence to remember is this: pain is information. It is not proof that you are weak, difficult, or too old for intimacy. A useful way to speak to a partner is, "I still want to be close to you, but my body needs us to slow down and understand why this hurts." That sentence protects connection far better than silent endurance. But pain is not the symptom most people hide. The third mistake is interpreting a repeated physical change before investigating it. Thomas began having difficulty maintaining an erection, not once, but repeatedly. He did not tell Helen. Instead, he stopped initiating affection because he feared it might lead to a moment he could not complete. When Helen reached for his hand at night, he sometimes pretended to be asleep. Helen noticed the distance, but she did not know the reason. She began to wonder whether he had stopped finding her attractive. Thomas noticed her becoming colder and assumed she was disappointed in him. Neither person had the full story, yet both were already reacting to conclusions. This is a common pattern. Interpretation comes before investigation. An occasional erection problem can happen during stress, anxiety, illness, or after too much alcohol. But erectile difficulty that happens often is worth discussing with a healthcare professional. It may be related to circulation, diabetes, nerve problems, medications, hormone issues, depression, anxiety, or other conditions. The same principles applies to a sudden or persistent change in desire, arousal, sensation, or orgasm. These changes can have physical, emotional, hormonal, medication-related, or relationship causes. So instead of asking, "What is wrong with me?" ask a more useful question. What changed? Did the problem begin after a new medicine? After surgery? After a heart event? During grief? When stress increased? When pain became harder to manage? When blood sugar became harder to control? The timing may reveal more than the symptom, and that leads to the fourth mistake, because sometimes the answer is not hidden in the relationship at all. It is sitting in the pill organizer. Robert started a new prescription. A few weeks later, his desire dropped sharply and his sexual response changed. He blamed age. His wife blamed herself. Neither suspected the small tablet he took every morning. Many older adults take several medications, and some medicines can affect desire, erections, ejaculation, lubrication, arousal, sensation, or orgasm. The answer is not to stop an important prescription on your own. Suddenly stopping certain heart, blood pressure, mental health, or other medications can be dangerous. The safer response is to document what changed and when it began. Bring a complete list to a healthcare appointment. Include prescriptions, over-the-counter medicines, vitamins, herbal products, sleep aids, pain relievers, and anything sold for energy or sexual enhancement. Then ask directly, could any of these be affecting my sexual function? A clinician may be able to adjust the dose, change the timing, consider an alternative, treat another condition, or explain that the medication is probably not the cause, but they cannot evaluate information you have hidden. And please notice the emotional trap. A medication side effect can look like rejection. A circulation problem can look like lack of desire. Pain can look like avoidance. Anxiety can look like indifference. This is why guessing can damage a relationship faster than the original health change. Now we reach the mistake I most want viewers to remember, because it often begins with embarrassment and ends with an ingredient the person never knew they had taken. The fifth mistake is using secret enhancement products. A person notices a change in performance. They do not want to discuss it with their partner. They do not want to make an appointment. Then an advertisement appears for a capsule, honey packet, chocolate, powder, or herbal blend promising fast results. The label says natural. The website promises privacy. The product looks easier than a difficult conversation. But natural is not a safety certificate. The United States Food and Drug Administration has repeatedly warned that some products marketed for sexual enhancement contained undeclared prescription drug ingredients, including sildenafil or tadalafil. In other words, the label did not tell the consumer what they were actually taking. That matters because these medicines can interact dangerously with nitrates, such as nitroglycerin used by some people with chest pain or coronary artery disease. The combination can cause blood pressure to fall to a dangerous level. Think about the chain of secrecy. The heart medication is in the cabinet. The enhancement product is hidden in a drawer. The partner does not know. The doctor does not know. The pharmacist does not know. Everyone who could have identified the interaction is missing the crucial information. A private concern has become a preventable risk. This does not mean approved treatments for erectile dysfunction are unsafe for everyone. Many people can use them appropriately under medical supervision. The danger is taking an unknown product, combining medicines without guidance, or using someone else's prescription. If you use any enhancement product, put it on your medication list. If you take nitrate medication, do not use erectile dysfunction medicine unless the clinician managing your care has specifically advised you about safety. And never assume a supplement is harmless because it came in honey, chocolate, or an herbal-looking package. The form is marketing. The ingredient is what affects your body. The sixth mistake happens when people guess what their heart can handle. After a heart attack, heart procedure, diagnosis of heart failure, or new chest symptoms, many couples become afraid. One partner worries that intimacy might trigger another event. The other becomes afraid to initiate any affection at all. Some people avoid intimacy for months without asking whether the restriction is necessary. Others do the opposite. They ignore unstable symptoms because they feel embarrassed to stop. Both reactions are based on guessing. For many people whose heart condition is stable, sexual activity may be possible. But the decision depends on the individual condition, symptoms, recovery, physical capacity, and medical advice. The most useful question is not, "Am I too old?" It is, "Based on my condition, is this activity safe for me, and what symptoms mean I should stop?" If you have unstable angina, severe or worsening cardiovascular symptoms, or have not been medically cleared after a recent cardiac event, seek professional guidance before resuming sexual activity. During intimacy, stop if you develop chest pain, severe or unusual shortness of breath, faintness, marked dizziness, or a sudden feeling that something is seriously wrong. New, severe, or persistent symptoms may require emergency help. Do not push through chest symptoms to avoid disappointing someone. And do not skip heart medication because you believe it affects sexual performance. Heart health comes first, and medication concerns should be reviewed with the prescriber. There is another side to this. Fear can affect physical response too. If a person spends the entire moment monitoring every heartbeat and imagining catastrophe, relaxation becomes difficult. That fear is not foolish, but the solution is informed confidence from a medical evaluation, not reassurance from a random video or a friend's experience. Now for the seventh mistake. It is believing age eliminates the need for protection. Many older adults were taught to think of condoms mainly as pregnancy prevention. After menopause, pregnancy is no longer the concern, so protection may disappear from the conversation. A new partner may look healthy. They may have been married for decades. Asking about testing may feel awkward or distrustful, but age does not protect anyone from sexually transmitted infections. People who are sexually active with a new partner, multiple partners, or a partner whose infection status is unknown may still be at risk. Condoms and other barrier methods can reduce the risk of many infections when used correctly, although no method removes every risk. Testing may also be appropriate depending on partners, symptoms, and individual history. Protection is not an accusation. It is an agreement between two adults who respect each other enough to discuss health honestly. A simple sentence is enough. Before we become intimate, I would like us to talk about protection and testing so we can both feel safe. A caring partner may feel nervous. They may have questions, but they should not shame you for protecting your health. And if someone refuses to discuss consent, symptoms, protection, testing, or boundaries, that is not a small detail. That is information about the relationship. Now let us return to the mystery from the beginning. What connects the old pace, hidden pain, erection changes, medication side effects, secret supplements, heart fears, and infection risk? At first, the answer appears to be silence. But there is something even deeper. The biggest mistake is deciding what a symptom means before asking what caused it. Pain becomes I am too old. An erection change becomes I am no longer a man. Reduced desire becomes my partner does not love me. A conversation about protection becomes you do not trust me. And a medication side effect becomes our relationship is failing. The body gives a signal. Then fear writes the story. The safer habit is to investigate before you interpret. To make that easier, remember the word safer. S is for symptoms. Pay attention to persistent pain, unexplained bleeding, sores, unusual discharge, burning with urination, repeated erection problems, chest discomfort, severe breathlessness, faintness, or a sudden major change from your normal pattern. A is for ask. Ask your partner what feels comfortable. Ask yourself whether you genuinely want to continue. Ask a healthcare professional about symptoms, medication effects, heart safety, dryness, testing, or treatment options. F is for full medication review. Keep an updated list of prescriptions, over-the-counter medicines, vitamins, herbs, and enhancement products. Never assume natural means interaction-free. Never share prescription medicine. Never stop an essential medication without professional guidance. E is for ease, not performance. Allow more time. Adjust for pain or mobility. Use an appropriate lubricant when needed. Let affection remain valuable even when the moment changes direction. Satisfaction is not measured only by speed, frequency, penetration, erection firmness, or orgasm. R is for risk protection. Discuss protection and testing when there is a new or uncertain exposure. Know your health conditions, know the symptoms that mean stop. and know when medical guidance is safer than private experimentation. Imagine Thomas and Helen one final time. Their turning point was not a miracle product. Thomas admitted that his body had changed. Helen admitted that intimacy had become uncomfortable. They reviewed medications, removed the pressure to perform, slowed down, and asked for professional advice. What restored closeness was not pretending nothing had changed. It was becoming curious instead of afraid. That is the message to carry from this video. A changing body is not automatically a broken body. You may need more time. You may need comfort measures. You may need a medication review, testing, or treatment. You may need to redefine intimacy around connection rather than performance. But you should never have to hide severe symptoms, tolerate ongoing pain, take mystery products, or gamble with a medication interaction just to prove that you are still capable. Before we close, remember the warning signs that should never be saved for another video. Chest pain, severe or unusual shortness of breath, fainting, marked dizziness, persistent genital or pelvic pain, unexplained bleeding, sores, unusual discharge, burning with urination, or a sudden major change that concerns you. Seek appropriate medical or emergency help based on the severity of the symptom. But one important question remains. How can you tell the difference between a normal age-related change, a symptom that should be discussed at a routine appointment, and a warning sign that may need urgent help? That distinction is where many people become confused, especially when a symptom appears briefly and then disappears. In the next video, we will examine 7 warning signs during intimacy that adults over 60 should never ignore, including one that may last only a few minutes but still deserves attention. Until then, remember this: age does not cancel intimacy. But intimacy should never require you to ignore your health, hide your symptoms, or let fear write the story before you know the facts.